Question 1. A 68-year-old male with a history of COPD is severely short of breath. His oxygen saturation, SpO2, is 88% on room air. What is the appropriate initial oxygen administration goal for this patient?
A.
Titrate oxygen to achieve an SpO2 of 100%.
B.
Apply a non-rebreather mask at 15 liters per minute.
C.
Titrate oxygen to achieve an SpO2 of 90% to 94%.
D.
Withhold oxygen unless the SpO2 drops below 85%. Answer: C. Titrate oxygen to achieve an SpO2 of 90% to 94%. This question tests the understanding of proper oxygen administration guidelines, especially for patients with a known risk for ventilatory drive issues, like those with chronic obstructive pulmonary disease. The keyword is COPD, which suggests caution regarding high oxygen concentrations. For most patients, the goal is an SpO2 of 94% or greater, but for patients at risk of hypercarbic drive suppression, which can happen with COPD, the goal is a more conservative 90% to 94%. This prevents unnecessary oxygen toxicity or suppression of the respiratory drive while still correcting hypoxia. For example, if a nasal cannula at 2 liters per minute achieves 92%, that is the correct initial administration. Remember to always titrate oxygen, start low, and adjust based on the patient's SpO2 reading and clinical presentation, rather than starting high for everyone. Question 2. When treating a patient with a laceration on the forearm that is spurting bright red blood, the first and most critical step in hemorrhage control is to
A.
Apply a tourniquet immediately proximal to the wound.
B.
Apply direct pressure to the wound with a dry, sterile dressing.
C.
Apply a pressure point to the nearest artery.
D.
Apply a cold compress to the site. Answer: B. Apply direct pressure to the wound with a dry, sterile dressing. This question addresses the critical skill of external hemorrhage control, with the keyword first, indicating the initial, primary intervention. Direct pressure, using a sterile dressing or clean cloth, is the immediate and most effective first step for controlling severe external bleeding in an extremity. It aims to physically seal the injured vessel and promote clotting, and it will control the vast majority of external bleeds. Only after direct pressure fails to control the bleeding should an EMT progress to the use of a tourniquet or hemostatic dressings. For instance, you should cover the spurting wound with a dressing and press down hard and continuously before considering other methods. The basic rule of bleeding control is always to start with the least invasive, yet most effective method: direct pressure. Question 3. You are assisting a patient who is actively seizing and has a history of epilepsy. This seizure has lasted longer than 5 minutes. The patient's condition is best described as
A.
simple partial seizure.
B.
Febrile seizure.
C.
Postictal state.
D.
Status epilepticus. Answer:
D.
Status epilepticus. The concept here is the classification of seizure emergencies, and the key clue is the duration, specifically a seizure lasted longer than 5 minutes. Status epilepticus is defined as a seizure lasting more than 5 minutes or having multiple seizures without a return to a normal level of consciousness between them. This condition is a true medical emergency because prolonged seizure activity can lead to brain injury and is associated with a high risk of death. For example, if a 4-minute seizure stops, the patient is likely entering the postictal state, but if it reaches 6 minutes, the patient is in status epilepticus and requires immediate advanced medical intervention. Recognize the 5-minute mark as the absolute critical threshold that elevates a seizure from routine care to a life-threatening emergency. Question 4. During the primary assessment of an unresponsive medical patient, you attempt to insert an oropharyngeal airway. The patient gags violently. What is the most appropriate action?
A.
Immediately suction the patient's mouth and pharynx.
A.
Remove the OPA and reattempt insertion using a smaller size.
C.
Remove the OPA and insert a nasopharyngeal airway. NP.
D.
Secure the OPA and continue with the breathing assessment. Answer C. Remove the OPA and insert a nasopharyngeal airway, NPA. This tests the proper technique and contraindications for airway adjuncts, with the keyword gags indicating a retained gag reflex. The presence of a gag reflex is the primary contraindication for the OPA because it can cause the patient to vomit or a laryngospasm, spasm of the vocal cords, further compromising the airway. The nasopharyngeal airway, NPA, is the next best option because it bypasses the oropharynx and is tolerated by patients with an intact gag reflex. For instance, if an unconscious patient responds to a painful stimulus by slightly pulling their arm back, they may still have a gag reflex and thus require an NPA instead of an OPA. The simple rule is, if they gag on an OPA, switch immediately to an NPA, provided there are no contraindications like severe facial trauma. Question 5. Which of the following is an example of implied consent?
A.
A parent gives permission for the treatment of their minor child.
B.
A conscious, alert adult verbally agrees to transport to the hospital.
C.
An unresponsive patient involved in a motor vehicle collision.
D.
A competent adult signs a refusal of care form. Answer C. An unresponsive patient involved in a motor vehicle collision. This question is centered on the legal concept of consent in emergency medicine, with the keyword implied, referring to consent that is not directly given. Implied consent, or the emergency doctrine, assumes that an unconscious, incapacitated, or severely injured patient would consent to life-saving care if they were able to respond. This legal principle allows the EMT to immediately provide essential care without fear of battery or legal recourse. An example of this is treating an overdose patient who is unconscious and unable to communicate their wishes. When a patient is unable to make a rational decision, always operate under implied consent to provide necessary treatment. Question 6. A 45-year-old male is complaining of crushing substernal chest pain. He is alert and oriented, and his vital signs are stable. Which of the following EMT interventions is a standard component of cardiac chest pain management, assuming local protocols allow?
A.
Administering oral glucose paste.
B.
Assisting the patient in taking 1 dose 0.4 mg of nitroglycerin.
C.
Administering 324 milligrams of chewable aspirin.
D.
Placing the patient in a Trendelenburg position. Answer. Administering 324 milligrams of chewable aspirin. This question tests the EMT's knowledge of standard pharmacological interventions for a suspected cardiac event, specifically an acute coronary syndrome, ACS. Chewable aspirin, 162 mg to 324 milligrams, is administered because it is a platelet inhibitor, meaning it helps prevent new clots from forming or existing clots from growing in the coronary arteries, and the action starts faster when chewed. While nitroglycerin may be used, the administration of aspirin is a core, high-priority intervention unless specific contraindications exist. For example, the patient chews the aspirin while the EMT continues with oxygen administration and preparing for transport. Always remember that aspirin is a non-negotiable medication for chest pain management unless a true allergy or active bleeding is present. Question 7. You are assessing an 8-month-old infant. The normal respiratory rate for an infant of this age typically falls within which range?
A.
8 to 16 breaths per minute.
B.
12 to 20 breaths per minute.
C.
20 to 30 breaths per minute.
D.
30 to 60 breaths per minute. Answer. C. 20 to 30 breaths per minute. The concept tested here is the baseline normal vital signs for pediatric patients, with the keyword 8-month-old infant, highlighting the need to recall the appropriate pediatric ranges. Infants and young children have much higher baseline respiratory rates than adults, reflecting their higher metabolic rate and smaller lung capacity. The range of 20 to 30 breaths per minute is the normal standard for an infant, although a small variance is acceptable. For example, a finding of 12 breaths per minute in this patient would be considered significantly slow and a sign of impending respiratory failure. When assessing pediatrics, it is essential to remember that faster rates are normal and lower rates are typically a serious warning sign. Question 8. What is the most common route of administration for the medication found in an EpiPen, epinephrine auto-injector?
A.
Sublingual.
B.
Intravenous.
C.
Subcutaneous.
D.
Intramuscular. Answer: D. Intramuscular. This question targets the EMT's understanding of common medication routes, specifically focusing on the widely used epinephrine auto-injector. Intramuscular (IM) injection is the standard route for the EpiPen because it allows for rapid absorption of the medication into the systemic circulation through the large muscles, typically the thigh. The goal is to quickly reverse the effects of anaphylaxis, such as bronchoconstriction and vasodilation. A practical example is administering the device into the patient's lateral thigh for rapid, life-saving medication delivery. Know that the IM route is generally the quickest non-4 way to get the medication into the bloodstream for a fast response. Question 9. In the context of a multiple casualty incident, MCI, using the START triage system, a patient who is breathing spontaneously but has a radial pulse and is mentally able to follow simple commands should be categorized with which color tag?
A.
Red, immediate.
B.
Yellow, delayed.
C.
Green, minor.
D.
Black, decisive. Answer: B. Yellow, delayed. This question tests knowledge of the simple triage and rapid treatment START system, where the patient's status determines their priority. The key word is follow simple commands, which means the patient is mentally alert enough not to be triaged as red, immediate. Because the patient has a patent airway, adequate circulation, radial pulse, and an altered but present mental status, they are considered yellow. An example is a patient with a closed fracture of the femur who is alert and stable but cannot walk. Remember that a yellow tag means the patient's treatment and transport can be delayed, but their injuries are potentially serious. Question 10. You arrive on the scene of a single-car motor vehicle collision. The conscious patient has significant blunt trauma to the head and neck. Current evidence supports the use of a cervical collar and a long spine board only when there are
A.
obvious signs of paralysis or loss of consciousness.
B.
Specific findings like pain, tenderness, or neurological deficit.
C.
Any mechanism of injury that suggests a spinal injury.
D.
A pre-existing history of spinal fusion surgery. Answer: B. Specific findings like pain, tenderness, or neurological deficit. This question addresses the current 2025 updates standard for spinal immobilization, which emphasizes selective spinal motion restriction. The keywords current evidence suggest a move away from routine spinal immobilization for all trauma patients. SMR is only indicated when the patient has specific risk factors like pain, tenderness, neurologic deficits, or a severely altered mental status after a significant mechanism of injury. For example, a patient with a severe head injury who is complaining of neck pain would absolutely require SMR. The takeaway is that SMR is a clinical decision based on physical assessment findings, not just the mechanism of injury alone. Question 11. What is the correct ratio of compressions to ventilations for a single rescuer performing cardiopulmonary resuscitation, CPR, on an adult?
A.
30 compressions. 2 ventilations.
B.
15 compressions. 2 ventilations.
C.
5 compressions. 1 ventilation.
D.
30 compressions. 1 ventilation. Answer: A. 30 compressions. 2 ventilations. This tests the foundational concept of high-quality basic life support, focusing on the correct rhythm for single rescuer adult CPR. The standard ratio for adult CPR, regardless of whether there is 1 or 2 rescuers, is 30 chest compressions followed by 2 ventilations. This ratio balances the need to maintain blood circulation with the need to provide oxygen. For example, the rescuer must complete a full cycle of 30 compressions at a rate of 100 to 120 per minute before pausing for the 2 quick breaths. Always prioritize high-quality chest compressions and know the 30 2 ratio as the universal standard for adult cardiac arrest. Question 12. A patient with severe hypoglycemia, low blood sugar, is conscious but confused and unable to swallow. The appropriate EMT treatment, if available and per protocol, is
A.
oral administration of glucose tablets,
B.
intramuscular injection of glucagon,
C.
administration of activated charcoal,
D.
administration of sublingual nitroglycerin. Answer: B. Intramuscular injection of glucagon. The concept tested is the appropriate treatment for an altered mental status in a diabetic emergency when oral administration is not possible. The keywords are hypoglycemia, confused, and unable to swallow, which eliminate the use of oral glucose paste or tablets due to the risk of aspiration. Glucagon is a hormone that raises blood glucose levels and can be administered intramuscularly, bypassing the need for a cooperative or conscious patient. For example, if the EMT is unable to establish IN4, the IM glucagon is the best option for rapidly increasing the patient's blood sugar. Remember that the route of administration must match the patient's level of consciousness to ensure both efficacy and safety. Question 13. Which of the following best describes the anatomical location of the stomach?
A.
Inferior to the diaphragm and posterior to the liver.
B.
Primarily in the right upper quadrant, RUQ of the abdomen.
C.
Superior to the lungs and anterior to the mediastinum.
D.
Primarily in the left upper quadrant, LUQ of the abdomen. Answer: D. Primarily in the left upper quadrant, LUQ of the abdomen. This question evaluates the EMT's knowledge of basic abdominal anatomy and organ location. The keyword is stomach, and you need to recall the abdominal quadrants. The stomach is primarily situated in the left upper quadrant, LUQ, deep to the left side of the ribs. Knowing the quadrant locations is essential for associating pain or tenderness with the underlying organ, such as the pain of an ulcer being in the LUQ. A simple way to remember organ locations is that the LUQ contains the stomach and spleen, while the RUQ contains the liver and gallbladder. Question 14. You are preparing to ventilate an apneic adult patient using a bag valve mask. B. What is the recommended rate for providing ventilations?
A.
1 breath every 3 to 5 seconds.
B.
1 breath every 5 to 6 seconds.
C.
1 breath every 8 to 10 seconds.
D.
1 breath every 12 to 15 seconds. Answer: B. 1 breath every 5 to 6 seconds. This addresses the core airway management skill of positive pressure ventilation, PPV, and the current American Heart Association, AHA standards. The key is apneic adult, which requires a specific and measured rate of ventilation. The recommended rate for an apneic adult, non-intubated or intubated, is 1 ventilation every 5 to 6 seconds, which equates to 10 to 12 breaths per minute. For example, to ensure correct timing, the EMT should squeeze the bag slowly over 1 second while counting squeeze, 1001, 1002, squeeze. Before repeating, proper ventilation timing is crucial to avoid hyperventilation, which can cause gastric distension and decrease cardiac output. Question 15. A patient has elected to refuse transport after an EMT assessment. What is the most critical piece of documentation required in the event of a refusal of care, ROC?
A.
A detailed list of all personal belongings left at the scene.
B.
The patient's exact words stating they understand the risks and still refuse.
C.
A copy of the patient's insurance card and next of kin information.
D.
A signed statement that the EMT legally cannot force the patient to go. Answer: B. The patient's exact words stating they understand the risks and still refuse. This question tests the legal and ethical requirements for documentation, focusing on the liability associated with refusal of care. The most critical element is documenting that the patient has decision-making capacity and fully understands the potential consequences, including death or disability, of their refusal. This is often called informed refusal. For instance, the EMT must write down that the patient understands the refusal could lead to worsening pain, internal bleeding, and possible death. To protect yourself legally, always document the assessment findings, the risks explained to the patient, and their verbatim confirmation that they understand and still refuse. Question 16. The pulse pressure of a patient with a blood pressure of 140/90 mmHg is
A.
50 millimeters of mercury,
B.
90 millimeters of mercury,
C.
140 millimeters of mercury,
D.
230 millimeters of mercury. Answer: A. 50 millimeters of mercury. This question tests the basic calculation and understanding of vital signs, with the keyword pulse pressure, referring to a specific component of the blood pressure reading. Pulse pressure is calculated by subtracting the diastolic pressure from the systolic pressure. Systolic, diastolic equals pulse pressure. In this case, 140 minus 90 equals 50 mmH. Pulse pressure provides important information about the patient's circulatory status and stroke volume. For example, a narrowing pulse pressure, e.g., 100 divided by 80 is equal to 20 mmHg, is a classic sign of compensated shock. Remember this simple math. The difference between the two numbers is the pulse pressure. Question 17. The primary purpose of conducting a thorough scene size-up is to
A.
determine the patient's chief complaint,
B.
determine the need for additional resources and ensure safety,
C.
initiate the focused history and physical exam,
D.
establish the patient's baseline vital signs. Answer: B. Determine the need for additional resources and ensure safety. This question focuses on the initial steps of patient management, with the keyword primary purpose guiding you to the most immediate and critical goal of the scene size-up. Before any patient care begins, the EMT must ensure that the scene is safe for themselves, their partner, the patient, and bystanders, and identify if more help is needed. An example of this is recognizing the odor of natural gas or observing hostile bystanders and immediately calling for fire or police support. Always remember that scene safety is the first and most fundamental step of the entire patient assessment process. Question 18. You are assessing an 85-year-old patient who is presenting with only generalized weakness and confusion. He is a known diabetic. This atypical presentation is common in which patient population?
A.
Pediatric,
B.
obese/bariatric,
C.
geriatric,
D.
traumatic. Answer: C. Geriatric. This question tests the EMT's awareness of altered disease presentations in specific age groups, with the keyword 85-year-old, pointing to the elderly population. Geriatric patients often present with vague, non-specific symptoms like weakness or confusion, rather than the classic symptoms of an illness. For example, an elderly patient having a heart attack might not complain of chest pain but simply report abdominal discomfort or general malaise. When dealing with an older patient, always maintain a high index of suspicion because a serious illness might be masked by a vague complaint. Question 19. A 30-year-old female patient is complaining of acute, severe, tearing abdominal pain that radiates to her back. She is hypotensive and tachycardic. The EMT should immediately suspect
A.
gastroesophageal reflux disease,
B.
acute cholecystitis, gallbladder inflammation,
C.
ruptured abdominal aortic aneurysm, AA,
D.
ectopic pregnancy. Answer: D. Ectopic pregnancy. The concept here is recognizing life-threatening gynecological emergencies, and the keywords are female patient, acute, severe, tearing abdominal pain, and signs of shock, hypotension, and tachycardia. While the pain could be a ruptured AAA, the demographic of a young woman immediately raises suspicion for an ectopic pregnancy, especially if the pain is severe and she is showing signs of hemorrhage. An example would be severe unilateral lower abdominal pain and shock. Always maintain a high level of suspicion for ectopic pregnancy in any female of childbearing age presenting with lower abdominal or pelvic pain and signs of shock, even if they deny being pregnant. Question 20. The primary drug an EMT is trained to administer or assist the patient with in the event of anaphylaxis is
A.
albuterol,
B.
epinephrine,
C.
naloxone,
D.
oral glucose. Answer: B. epinephrine. This tests the EMT's knowledge of basic pharmacology and treatment for allergic emergencies, with the keyword anaphylaxis, indicating a severe, life-threatening allergic reaction. Epinephrine is the primary medication because it acts as a vasoconstrictor to raise blood pressure and a bronchodilator to open the patient's airway, reversing the life-threatening effects of anaphylaxis. For example, a patient with a bee sting allergy requires epinephrine to stop the rapid progression of swelling and shock. Remember that epinephrine is the crucial, rapid-acting drug that directly counteracts the systemic effects of a severe allergic reaction. Question 21. What is the standard concentration and flow rate for a non-rebreather mask, NRB, for a patient experiencing severe respiratory distress?
A.
100% oxygen at 6 to 8 liters per minute.
B.
90% oxygen at 4 to 6 liters per minute.
C.
Up to 90% oxygen at 10 to 15 liters per minute.
D.
50% oxygen at 2 to 4 liters per minute. Answer: C. Up to 90% oxygen at 10 to 15 liters per minute. This question addresses the equipment and administration of high-flow oxygen, with the keyword severe respiratory distress, indicating the need for maximum oxygen delivery. The non-rebreather mask, NRB, is the preferred device for delivering the highest concentration of supplemental oxygen possible short of positive pressure ventilation, which can be up to 90%. To function properly and ensure the reservoir bag remains inflated during inspiration, the NRB must be set to a flow rate of 10 to 15 liters per minute. A practical example is using the NRB on a patient with carbon monoxide poisoning to deliver the maximum amount of oxygen. Always ensure the NRB reservoir bag is fully inflated before applying it to the patient to confirm adequate oxygen delivery. Question 22. A patient presents with hot, dry, red skin, is unresponsive, and has a high body temperature. The EMT should immediately suspect
A.
heat cramps,
B.
heat exhaustion,
C.
heat stroke,
D.
dehydration. Answer: C. heat stroke. This question distinguishes between different types of heat-related emergencies, with the keywords hot, dry, red skin, and unresponsive, pointing to the most severe condition. Heat stroke is a true life-threatening emergency caused by the failure of the body's temperature-regulating mechanism, resulting in a dangerously high core temperature and an altered mental status. In contrast, a patient with heat exhaustion would still likely be sweating and have a relatively preserved mental status. For example, a marathon runner who suddenly collapses, stops sweating, and is unconscious needs immediate aggressive cooling for heat stroke. When a patient in a hot environment has an altered mental status and is not sweating, think of it as a critical emergency requiring rapid cooling. Question 23. What is the most likely cause of hypotension, low blood pressure, and muffled heart tones following blunt trauma to the chest?
A.
Simple pneumothorax.
B.
Hemothorax.
C.
Cardiac tamponade. D. Aortic dissection. Answer: C. Cardiac tamponade. This question tests the EMT's knowledge of the triad of physical findings associated with a critical, life-threatening chest injury. The key findings, hypotension, jugular venous distension (JVD), and muffled heart tones, are collectively known as Beck's triad, which is the classic presentation for cardiac tamponade. Cardiac tamponade occurs when fluid, usually bloody, rapidly collects in the sac around the heart, squeezing the heart and preventing it from filling properly. For instance, the sternum hitting the heart in a car crash can cause this condition, leading to obstructive shock. Whenever you see the combination of hypotension and muffled heart tones, Assume the patient has a critical problem requiring immediate transport. Question 24. A patient is found unresponsive with an empty pill bottle of an unknown narcotic nearby. The most appropriate immediate intervention, per protocol, after ensuring scene safety and the airway, is the administration of
A.
albuterol via nebulizer,
B.
activated charcoal,
C.
naloxone Narcan,
D.
oral glucose. Answer: C. Naloxone Narcan. This addresses the core treatment for suspected opioid overdose, with the keywords unresponsive and narcotic, indicating a probable respiratory depression from an opioid. Naloxone is an opioid antagonist that rapidly reverses the central nervous system and respiratory depression caused by an opioid overdose. Activated charcoal is typically only used for ingested poisons that are not opioids. A practical example is administering the naloxone intranasally to reverse the patient's respiratory depression and restore spontaneous breathing. Remember that naloxone is the priority intervention in a suspected opioid overdose because it is the only one that directly addresses the cause of the respiratory failure. Question 25. Which of the following best defines the term perfusion?
A.
The process of oxygen and carbon dioxide exchange in the lungs.
B.
The force exerted by the blood against the walls of the arteries.
C.
The circulation of blood through an organ or tissue in adequate amounts to meet the cell's needs.
D.
The movement of air into and out of the lungs during respiration. Answer: C. The circulation of blood through an organ or tissue in adequate amounts to meet the cell's needs. This question tests the basic understanding of core anatomical and physiological principles, with the keyword perfusion, representing the life-sustaining process of oxygen and nutrient delivery. Perfusion is the adequate circulation of blood that supplies every cell in the body with what it needs to survive and removes waste products. Shock, which is a state of hypoperfusion, occurs when this circulation is inadequate. For example, a patient in shock has poor perfusion to the brain, which is why they become confused or unresponsive. Simply remember that perfusion means good circulation and is the single most important physiological process the EMT must maintain. Question 26. In the context of a motor vehicle extrication, who is primarily responsible for securing the vehicle's electrical system and stabilizing the vehicle?
A.
The EMT providing patient care.
B.
The fire department or rescue personnel.
C.
The supervising law enforcement officer.
D.
The on-scene EMS supervisor. Answer: B. The fire department or rescue personnel. This question addresses the operational aspect of an EMS response, specifically focusing on roles during extrication. The keyword securing the vehicle's electrical system and stabilizing the vehicle refers to safety and extrication functions, which are the primary responsibilities of fire or rescue personnel. The EMT's main responsibility is patient care, which should not be delayed by performing extrication tasks. For example, the fire crew uses cribbing to stabilize the vehicle, while the EMT simultaneously accesses the patient inside. The fundamental rule is to let fire/rescue handle the hazards and the hardware so EMS can focus on the patient's healthcare. Question 27. When conducting a secondary assessment on a conscious medical patient complaining of difficulty breathing, the EMT should prioritize
A.
a detailed head-to-toe physical exam.
B.
Obtaining a full history of the present illness, HPI, using the OPQRST mnemonic.
C.
Performing a rapid trauma assessment.
D.
Immediate vital sign measurement and administration of a meter-dose inhaler, MDI. Answer: B. Obtaining a full history of the present illness, HPI, using the OPQRST mnemonic. This question tests the prioritization of the secondary assessment for a conscious patient with a medical complaint, and the keyword conscious medical patient guides the focus to history taking. For a medical patient, the secondary assessment is focused on gathering the patient's history using mnemonics like OPQRST, onset, provocation, quality, radiation, severity, time, and sample, signs/symptoms, allergies, medications, past history, last oral intake, events leading up. A rapid trauma assessment is only necessary for a trauma patient. For example, asking the patient when the difficulty breathing started, onset, and what makes it better or worse, provocation, is crucial for developing a treatment plan. Always remember that for conscious medical patients, the patient story is your most valuable diagnostic tool. Question 28. Which component of the negligence claim refers to the failure of the EMT to act as a reasonable, prudent person would in a similar situation?
A.
Causation.
B.
Damages.
C.
Breach of duty.
D.
Duty to act. Answer: C. Breach of duty. This concept is centered on the legal definition of negligence, with the keyword failure of the EMT to act as a reasonable, prudent person, defining the necessary element. A breach of duty occurs when the EMT deviates from the accepted standard of care, meaning they did something wrong or failed to do something they should have done. For example, if an EMT fails to perform necessary CPR on a pulseless patient, that failure is a breach of duty. Understand that negligence requires all four elements: duty, breach, causation, damages to be present, and a breach is the specific action or inaction that violated the standard of care. Question 29. When performing effective chest compressions on an adult, the compression depth should be approximately
A.
At least 1 inch, 2, 5 cm, but no more than 1, 5 inches, 3, 8 cm.
B.
At least 2 inches, 5 cm, but no more than 2, 4 inches, 6 cm.
C.
At least 3 inches, 7, 6 cm, but no more than 4 inches, 10 cm.
D.
Approximately 1/3 the depth of the chest. Answer: B. At least 2 inches, 5 cm, but no more than 2, 4 inches, 6 cm. This tests the proper technique for high-quality adult CPR, focusing on the critical component of compression depth. The recommended compression depth for adults is at least 2 inches, 5 cm, but should not exceed 2, 4 inches, 6 cm. This ensures adequate pressure is applied to circulate blood without causing unnecessary injury. For instance, leaning on the chest between compressions or applying insufficient depth renders the compressions ineffective. Remember that depth and rate, 100-120/min, are equally important for generating effective blood flow during CPR. Question 30. A patient has a fever, is coughing up green sputum, and has localized crackles, rales, upon auscultation of the lungs. This presentation is most consistent with
A.
Spontaneous pneumothorax.
B.
Pulmonary embolism.
C.
Pneumonia.
D.
Hyperventilation syndrome. Answer: C. Pneumonia. This question tests the EMT's ability to correlate physical assessment findings with a common respiratory disease, with the keywords fever, green sputum, and localized crackles being classic indicators. Pneumonia is an infection of the lung tissue, which typically causes a productive cough, sputum, and the sound of crackles as fluid collects in the alveoli. This differs from a pneumothorax, which causes absent or diminished lung sounds. For example, the patient reports feeling sick for several days before the fever and cough worsened. The combination of fever, colored sputum, and lower airway noise should always lead you to consider an infectious process like pneumonia. Question 31. What is the recommended suctioning time limit for an adult patient's airway?
A.
No more than 5 seconds.
B.
No more than 10 seconds.
C.
No more than 15 seconds.
D.
Suction until the airway is clear. Answer: C. No more than 15 seconds. This question addresses a critical safety rule in airway management, where the keyword time limit emphasizes the danger of prolonged suctioning. The maximum duration for suctioning an adult patient is 15 seconds because suctioning removes air and oxygen along with secretions, which can cause or worsen hypoxia. If the airway is not clear after 15 seconds, the EMT must reoxygenate the patient before reattempting suction. For example, if you suction for 10 seconds and the airway is still blocked, You must stop, ventilate the patient for 30 seconds, and then suction again. Always adhere to the time limit to prevent the patient from becoming dangerously deprived of oxygen. Question 32. In which of the following scenarios is the administration of activated charcoal most likely indicated?
A.
A patient who overdosed on a strong acid, corrosive.
B.
A patient who ingested a large amount of aspirin, salicylate.
C.
A patient who overdosed on a petroleum product, hydrocarbon.
D.
A patient who is unresponsive due to alcohol intoxication. Answer. B. A patient who ingested a large amount of aspirin, salicylate. This question tests the indications and contraindications for the oral administration of activated charcoal, with a keyword indicated seeking the appropriate use. Activated charcoal works by binding to certain ingested toxins, like many medications, in the stomach and small intestine, preventing their absorption into the bloodstream. It is contraindicated for corrosives, acids/alkalis, and hydrocarbons, petroleum products, due to the risk of aspiration and subsequent lung damage, and is not effective for alcohol. For example, if a child eats a bottle of Tylenol acetaminophen, activated charcoal would be a suitable initial intervention. Remember that activated charcoal works well for most ingested pills, but never give it to a patient who has ingested a corrosive substance or has an altered mental status. Question 33. A 40-year-old male is standing on the side of a highway, cursing at imaginary people and attempting to direct traffic. He is sweating profusely and is aggressive. Your first priority is
A.
restraining the patient immediately to prevent injury.
B.
Performing a full physical assessment to find a medical cause.
C.
Ensuring scene safety, including calling for law enforcement assistance.
D.
Attempting to calm the patient down with verbal de-escalation. Answer. C. Ensuring scene safety, including calling for law enforcement assistance. This question tests the absolute priority in managing behavioral and scene safety emergencies, with the keyword first priority, demanding a focus on the most immediate threat. When a patient is acting irrationally, aggressively, or posing a threat to themselves or others, scene safety is the highest priority, and securing assistance from law enforcement is necessary to make the scene safe. Attempting to calm an aggressive, psychotic patient without backup can put the EMT at extreme risk. For example, if the patient has a weapon or is standing in the middle of a busy highway, no patient care can begin until the hazard is controlled. Always remember that EMTs should never attempt to manage a physically violent or unpredictable patient without adequate security and backup. Question 34. What is the appropriate position of comfort for a patient experiencing cardiogenic shock?
A.
Supine with the feet elevated 12 inches, Trendelenburg position.
B.
Lying flat on the left side, recovery position.
C.
Supine with the head and torso elevated to 45 degrees, semi-Fowler's position. D. Prone with the head turned to the side. Answer. C. Supine with the head and torso elevated to 45 degrees, semi-Fowler's position. This question addresses the proper positioning for patients experiencing a specific type of shock, where the keyword cardiogenic shock indicates pump failure and potential fluid backing up into the lungs, pulmonary edema. Patients with cardiogenic shock often have severe difficulty breathing, which is relieved by sitting up, so the semi-Fowler's position is the position of comfort and improves breathing. Lying flat will worsen their shortness of breath and fluid accumulation in the lungs. For example, a patient with a heart attack and fluid in the lungs will immediately feel better when moved to a seated position. A general rule for any patient with difficulty breathing, regardless of the cause, is to allow them to sit up unless contraindicated by severe hypotension. Question 35. A key difference between angina pectoris and an acute myocardial infarction, AMI, is that angina pectoris chest pain is typically
A.
relieved by rest or nitroglycerin.
B.
Only felt in the left arm and jaw.
C.
Not associated with shortness of breath.
D.
Always lasts longer than 30 minutes.
Answer. A.
relieved by rest or nitroglycerin? This question is about distinguishing between the two most common types of cardiac pain, with a contrast between angina pectoris and acute myocardial infarction being the core concept. Angina pectoris is temporary chest pain caused by an increased demand for oxygen in the heart that is not met by the blood supply, and the pain typically subsides with rest or the administration of nitroglycerin. Conversely, the chest pain from an AMI heart attack is caused by irreversible heart muscle damage and is generally not relieved by either rest or nitroglycerin. For instance, if a patient's chest pain immediately resolves after sitting down and taking one nitroglycerin tablet, it is more likely stable angina. Remember that chest pain that goes away with rest or nitro is generally considered angina, while pain that persists is a medical emergency requiring definitive care.